Did you know that acid reflux affects millions of people worldwide, including yours truly? Well, in this video today, we're going to go through the science of acid reflux. In this video today, we'll discuss exactly what is GERD, or gastroesophageal reflux disease. Man, that's a handful. We'll discuss why people get GERD, what are symptoms of GERD. I'll discuss some natural options to get your GERD taken care of. And at the very end of the video, I'll give you my recommendations on when you need to see a poop guru like me to get your GERD taken care of. Guys, let's talk about poop. Howdy y'all, Dr. Islam here, aka your poop guru and gut microbiome expert. I'm a board certified gastroenterologist trained at the Mayo Clinic, and my passion is to give you, yes you, the best tips and tricks so you can live your best life from the top all the way down to the bottom. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel and newsletter, and come see yours truly at Lubbock Gastro to get your GI needs taken care of. So GERD stands for gastroesophageal reflux disease. GERD! And GERD really describes two main symptoms that people have. One is regurgitation, or food coming up, but also pain, that heartburn pain that's going in the middle of your chest. These are actually symptoms of GERD. Now, GERD happens when too much acid goes up into the esophagus. Now, all of us have acid that goes up into the esophagus. It is the normal part of just living. And we have a valve called the lower esophageal sphincter. This valve is closed every single time we're not eating and at rest. So right now, I'm talking to you, my sphincter is closed, and because it's closed, acid cannot come up. Now it opens when we swallow, sometimes when we breathe, and certainly after we eat, allow food to pass down from the esophagus to the stomach. The issue is that if that valve is open longer and more often, that can cause acid to go up into the esophagus to cause symptoms of GERD. And so really, GERD happens, or symptoms of GERD happen, mainly because it is a valve problem and not typically an acid problem. This is very confusing for a lot of my patients because they see things on the internet, how it's too much acid, it's too little acid, and certainly that can play a role. But for the vast majority of people, it is a valve problem and not an acid problem. So we try to see if there's ways we can hopefully adjust that and get that taken care of. So what are the symptoms of GERD? The classic symptoms are heartburn or regurgitation, things coming up. But you can have other symptoms that can be associated with GERD, including chest pain, feel like you're having a heart attack whenever you have that acid going in there, sometimes difficulty swallowing, chronic cough or asthma, constant throat clearing, or feeling there's something in your throat like a frog in your throat. These are symptoms of GERD that can be associated with having this disease. And once again, typically it's due to that valve being a problem, and that valve being open longer and more often can cause that acid to go up into the esophagus to manifest in terms of these symptoms. So what are some natural ways that I recommend to get your GERD taken care of? Here's what I recommend. Number one, you need to not eat late at night. Here, I recommend to all my patients, especially if you have nighttime reflux, to wait at least 3 or 4 hours after you eat before you lie down. That food will just sit in your stomach and cause acid to build up, to go up into your esophagus, to cause the symptoms of acid reflux, heartburn, and regurgitation. So make sure you wait some time, at least 2 or 3 hours before you lie down. Number two, if you're going to lie down on your left side. That left side actually causes an anatomical change to cause that sphincter to be closed so you don't have acid going up into the esophagus. So if you do lie down on your left side. Number three, consider avoiding some of the trigger foods that are known to cause acid reflux. You know what they are. They're foods that we all enjoy. Things like coffee, caffeine, spicy foods, tomato-based foods. Oh my gosh, the list can go on. Now here's the deal about foods, is that not every single person has a trigger when it comes to food. So for me, for example, I could have coffee, not a problem. I could have chocolate, not a big deal, but beef is my trigger. So use this as a guide to determine exactly what foods are your trigger. If you don't have a food trigger, that's perfectly fine. Don't worry about avoiding that. But if you know certain foods can make your reflux worse, you may want to consider removing that. Next, try chewing mastic gum. Mastic gum has been shown in clinical trials to help out when it comes to acid reflux. It helps out with digestion, to move things through, and it can actually help out with producing a lot more protection in your stomach. Consider deep breathing. Deep belly breathing. This is me doing a deep breathing can actually cause that valve to be closed and push food down as well. So do that to help out when it comes to your acid reflux symptoms. Add fiber to your diet. Fiber is such an effective tool for everything inside your gut, and it actually can help out with your acid reflux. It can bind that acid to prevent less production of that acid going up into your esophagus to make your symptoms better. So add fiber in your diet. And then lastly, the most effective thing you can do is to lose weight. We know that obesity will trigger acid reflux. We know that obesity can make reflux symptoms worse, and we know that obesity can make you have a high risk of developing cancer in the esophagus. So lose weight as much as you can. It's going to help out with your acid reflux. Now, a lot of people have acid reflux, but the question I get, hey, Dr. Islam, when do I need to see a doctor? Here are my recommendations. If you have trouble swallowing, it's called dysphagia. This is a difficulty with food getting stuck or water getting stuck as it's going down. This is not normal and needs to be investigated to find out exactly what's going on. If you have long-standing acid reflux and you don't know exactly why, you may want to consider taking a look to see exactly what's going on, or to see a healthcare provider to see if there's other options to get your reflux taken care of. Long-standing reflux, we know, is a risk factor for cancer of the esophagus. So you may want to do an investigation to find out exactly what's going on. If you're starting to lose weight or get fuller quicker than normal, this is not a normal thing to have. Early satiety or getting fuller earlier is never a normal finding that needs to be investigated. If you start to notice black stools or vomiting of blood or frankly bloody stools, or you are anemic, get that checked out. That is not normal. That could be a sign of an ulcer or inflammation going on inside your GI tract. Guys, here's my call to action to you. Let's conquer acid reflux together. Try these lifestyle changes, see if they help out. Implement them one at a time to hopefully get your acid reflux under control and get you taken care of. Here's my question of the day. What have you tried to help minimize your acid reflux? What's worked? What hasn't worked? Comment down below. I would love to hear what you guys have to say. Well, thank you for watching. Don't forget to smash that like button, like, share, and subscribe. And don't forget to come see me, your poop guru, to get your acid reflux taken care of. And thank you for watching. Don't forget, let's talk about poop. Thanks, everyone.